Research is showing how we can better treat people who are addicted to opioids. That data was collected right here in our area. KEZI 9 News reporter Amber Wilmar spoke with a doctor at Serenity Lane in our exclusive report tonight. Amber?
Renee, the opioid crisis is costing lives. That's why the study is so important, because it can help centers provide better treatment. And another study says it's also costing the government a lot of money.
A new study based right here in Coburg is shedding light on drug use in Oregon, and all the information for this national study was collected here from patients undergoing treatment at Serenity Lane.
And we're surprised by the results.
The results show high rates of combined drug use, specifically opioid and methamphetamine. The medical director at Serenity Lane, Dr. Eric Geisler, says based on his work with patients, the combined use of the two drugs is a vicious cycle. Many patients use heroin and opioid to offset side effects from meth, and then use meth to tolerate heroin withdrawal. But he says this insight is crucial.
A lot of times the combination of those two drugs can be very tricky to get people stabilized when they're using both together.
These results here at Serenity Lane came out just after another national study that shows how the misuse of opioids is taking a chunk of money out of the government's wallet. Between 2000 and 2016, the cost of opioid misuse for state governments was $11.8 billion. That breaks down to about $1.7 billion in sales tax and $10.1 billion in lost income tax. That study was done by the National Center for Biotechnology Information, and it says the federal government also lost $26 billion in income tax revenue. Dr. Geisler says, in addition, there's a huge cost to the community, both criminally and medically. So the more they know, the better.
The more we know about how the patients are using these drugs, the more we can help them to detox and then to stay off of them.
And today, the Senate unanimously passed a bill that would make getting access to drugs that help with overdoses a lot easier. I'll show you how that would work on KEZI 9 News at 6. For now, live in the studio, Amber Wilmarth, KEZI 9 News.
Very interesting. Thank you, Amber. It's ranked